Hey everyone, John here from Foundations Medical Informatics, and today we'll be talking about viral load. We'll discuss what viral load is, how viral load changes, how often your viral load should be tested, the role that viral load plays in deciding when to begin treating HIV, and the effect that viral load has on HIV transmission. When a healthcare provider orders a test on your viral load, they're trying to assess the level of HIV in your bloodstream. Knowing this level can help your provider monitor the progression of your condition and can allow them to see if your HIV medications are working. Without treatment, your viral load is directly related to your CD4 levels. Typically, if your viral load is high, your CD4 levels will be low or dropping. This makes you more vulnerable to opportunistic infections. The main goal of your antiretroviral medications is to prevent the replication of HIV in your body. This will lower your viral load and protect your immune system. You may be asking, what's a normal viral load level? The truth is, there is none. This is because people who don't have HIV have a viral load level of 0. So there's no normal, healthy level to compare to. With that being said, having the lowest possible viral load level is ideal. A viral load test measures the number of viral particles in a milliliter of your blood. These particles are often known as copies. The goal of HIV treatment is to bring your viral load to an undetectable level. This is usually a level lower than 40 to 70 copies per milliliter of blood. Your viral load is a number which will change considerably over time. Usually, after you've first been infected with HIV, your viral load will be extremely high. But over time, your immune system will respond and bring your viral load to a steady level. This is often called a set point. Once the set point has been reached, your viral load levels will likely remain stable and perhaps even low for a period of time. But over time, your viral load levels will gradually increase, causing a subsequent drop in your CD4 levels. Eventually, this may reach a level where they begin to hinder your immune system. It's at this point which antiretroviral treatment becomes critical, though you'll likely be treated long before you reach this point. When you're first diagnosed, your HIV care provider will probably order a viral load test in order to determine a baseline level. After that, a viral load test will probably be done every 3 to 6 months before you begin receiving HIV medication, and every 2 to 8 weeks once you start or change medications. When looking at viral load tests, it's the overall trend in your viral load that's most important, not the value of each individual test. When deciding whether or not to begin HIV treatment, most healthcare providers will first look at your CD4 count. Federal HIV treatment guidelines recommend for HIV treatment to be started if your CD4 count falls below 350 cells per milliliter of blood. But this is subject to change, so stay tuned for the latest updates. However, because there's a strong association between viral load and CD4 cell count, some providers may opt to start treatment based on viral load alone. In any event, remember, the goal of treatment is generally to reach undetectable, a point where there's very little viral replication and therefore very little chance of damage to your immune system. Studies have shown that having a low viral load decreases the risk that you'll pass HIV to another person through sexual contact. But having a low viral load doesn't guarantee that you won't transmit HIV to someone else. Even when your viral load in your blood is undetectable, HIV can still be present in your semen, vaginal fluids, rectal fluids, breast milk, and other parts of your body. You should continue to take steps to prevent HIV transmission, even when your viral load is undetectable. This means that the use of condoms for all sexual encounters is essential. That concludes this Foundations Medical Informatics video. Feel free to leave a comment or send an email if you have any questions. And as always, thanks for watching.